If you introduce yourself, that'd be great.
Sure. Hi, I'm Gabriel Schwartz. I'm an assistant professor of health management and policy at Drexel University's School of Public Health here in Philadelphia. I'm from the California Bay Area, which is part of the reason I got into housing and health research, as you can imagine. But I'm a social epidemiologist. So epidemiologists study what causes disease, what can protect you from disease. Social epidemiologists study how do social exposure, social policy, things like segregation or police violence or housing or your community ties, how that shapes your health. So that's sort of my area of research.
Thank you. And yeah, it's a good explanation because I thought I knew, and then that's better.
It's niche.
It is. But so today we're going to be talking about two articles you worked on. One is called Moving Because of Unaffordable Housing and Disruptive Social Safety Net Access Among Children. And then the second one is Eviction as a Community Health Exposure. And I really liked, because of your specialty, how you approached each of these things that I think we understand on a social level of how housing and eviction would impact kind of the overall lifestyle, but you really look at it as how it affects the health of the people who are experiencing it. And I'd love for you to begin by talking about the first article and how moving, for various reasons, and you can get into that as well, how moving actually affects children especially and their health outcomes.
Sure. So part of the motivation for this was a few papers. There's a group of people who study this. Some of them I've worked on, some of them I haven't. Thinking about how the housing crisis, we say, gets embodied, how it impacts people's well-being and especially kids. And that's starting as early as gestation, when people are pregnant. Because, I mean, eviction itself is quite stressful, and not being able to afford your housing and missing rent payments is extremely stressful constantly. And that stress can do things like induce miscarriages, reduce your immune system's ability to fight infections, because it has these systemic hormonal effects. But it also means often that people literally are exposed to the elements if they don't have another place to go, ended up in crowded housing, which means that they have more exposure to infectious disease, sometimes take the best housing they can get because they're looking for someplace quickly, which means places with mold exposure or lead exposure. And so we're worried about kids in a variety of ways. And also how sort of they are able to thrive in life. So we've done some studies showing, if you take kids in elementary school, those who got evicted in the past year, their cognitive skills assessments are like a full grade, half a grade behind their peers who are not evicted on average. Not every kid, but it's difficult for children to deal with that stress and that material deprivation. And we know too that when families sort of are up against the wall on housing, they're spending on things like healthcare or food gets scrapped. So kids who are evicted, they have like twice the rate of food insecurity afterwards as kids. So that's the background, and sort of led to this question of, well, a lot of our social safety net programs, do we imagine as like you're behind on your luck, a big bill comes in, you have a medical crisis, and we have the social safety net that catches you. We have SNAP, people think of as food stamps. We have like Medicaid for folks who have difficulty acquiring insurance. And that keeps people afloat. But a lot of those programs require an address. And a lot of those programs require you to recertify every year. and they like mail that recertification paperwork to you on whatever address they have. So if you got evicted from your housing and while you're trying to find a place to sleep, didn't call the SNAP office to be like, just FYI, I moved, like, here's my new address. And by the way, I might have 4 new addresses because I'm sleeping on my friend's couch and then I sleep on my sister's couch, you know. Or maybe I'm in a shelter and like that shelter is not keeping track of everybody's benefits. So it can be really hard to stay on these programs, and it can be hard to, you know, have an address to sign up for them in the first place. I mean, I don't know if we want to get immediately into the paper, but this is sort of what we look at. Like, are people who get evicted more likely to also experience disruptions to SNAP, disruptions to programs like WIC, which are the supplemental nutrition program for women, infants, and children, for pregnant women and kids, or for Medicaid. And we do see like much higher rates of people falling off the rolls. In this particular study, it's a little bit hard to say what direction. Like, do you fall off the rolls and then that puts you in bad financial shape and then you get evicted, or vice versa? But we've looked in a study in New York, linked people's Medicaid records to these eviction records the city holds. And in fact, like, people are 40–60% more likely to fall off the Medicaid rolls, sometimes for months, after an eviction. So I feel like you think of a kid, especially, who just wants, I mean, if you're a parent, like, you want them to have food, you want to be able to take them to the doctor, you want to have like vaccinations. And it's like, just when life is worse for you, suddenly you don't have access to those things. It feels like a real failing of our policy system.
Yeah, and I think before we get into the eviction paper, I'd kind of like to talk about, because the first paper I mentioned talks a lot about cost-driven versus non-cost-driven moves. And
Yeah,
I'm
great question.
confused by the fact that both the moving itself is traumatic in itself
Yeah,
to
yeah.
lower income people. And I'd really like you to explore that as
Mm.
because I think that if you think about it for a second, it makes sense, but it wasn't a connection I made until I read the paper.
Yeah, it's a great question. So part of the trouble in all this is, like, you know, moving is hard on kids in general. Anyone who's been a kid who's moved or had kids who've moved, like, often change schools. It's just like your whole routine gets disrupted. But of course, for low-income families who have to stay on all these programs, moving in general can be difficult. The difference is, if you move and you did it because you say, well, I found a place in a better neighborhood, I got a better job somewhere else. Those moves are planned for, they are prepared for. You often have help in some capacity, or you get your friend, you get a brother, whatever, to help you, and you have time to mentally prepare and deal with all the logistics of moving and updating all your information. It still can lead to things falling through the cracks, but there's this whole category, like, maybe you didn't get an eviction notice, but you missed a rent payment and your landlord said you got to get out of here, but they didn't technically sue you, or you're worried about that, so you leave. Or, you know, let's say it's June and your lease is up in September, and your landlord said, well, I'm raising your rent $600. And for a lot of people, even $100, like, it's a huge burden. Even for people who have some kind of housing support, like, even if you're only paying 30% of your income for housing, it's like, well, if your rent goes up $400, it's like kind of untenable. And so those moves are less planned for. You're doing them often without a lot of resources. You often can't pay the rent to begin with, much less pay for movers. And so I think there's a lot of like psychology research about, moving's hard for kids. And you're like, yeah, but some moves, some moves are like upwardly mobile, and some moves are like, I really can't afford to stay here anymore. And those have a different um, financial, psychological, social tenure to them.
And I think a component of it that we don't often think about for people who don't use services,
Mm,
how, I don't want to say punishing, but how many hoops there are to jump through, and sometimes how antiquated those hoops are and provide barriers that we don't think of necessarily from an administrative point of view as barriers, but to someone who is become unhoused or lost their footing. You mentioned postcards, but I mean, just getting an ID, right? And some of the things you
absolutely.
do for recertification really are dependent on stable, semi-permanent, permanent housing, correct?
Absolutely. I mean, I think WIC is the program for pregnant women, infants, and children that gives you sort of like equivalent to a EBT card, like a general SNAP program, but it's really for like specific nutritious food during the early years of a child's life or their fetal development. Um, that often you have to recertify for every 6 months, and different states run different WIC programs, and many of them require that you have a doctor's visit to evaluate some sort of risk factor. And so you can imagine, like, okay, I was forced to move because I couldn't pay the rent. I'm living now with my sister. I was living in New York, but I've crossed over into New Jersey. I now have like a new state. I have to get like a new residence. I have to find a new doctor because my old doctor is now 2 hour right away, and I have to do that every 6 months. Like, it's just doesn't feel humane. But I think the policy advocacy is like, even if you don't care about people, which I think we should, like, it's just inefficient. Like, all these programs pay back in stabler families, kids who are better to get able to get better education and grow up healthier. And we're making it very, very difficult um, to make that investment in families. And they're really paying the cost for it. And then we all do too later, because, dealing with the sicker community, there's all sorts of implications for our economy, for our health system. So yeah, it's onerous, and finding ways to make it less onerous on everybody. I mean, it's easier if you have to move, but making it less onerous in general, I think that can have really positive implications for our well-being.
Yeah, and I think we've kind of danced around it, but we haven't actually said how these moves affect childhood health. So, I mean, by services and disruption, but also there's, and we'll get into this more with the evictions, but just for the moving part of it, what did you find outcomes for children were? That makes sense.
Yeah. A little outside of this particular paper, but I think in the education and sort of like child cognitive development and socio-emotional development, moving in general is just like a huge change. It's extremely stressful. Kids are less able to focus. Kids are less able to have a stable mental health, end up with like worse internalizing symptoms, what we call it, when kids are like detached and sad, more externalizing system when kids act out. So moving in general is hard. Moving when you have to because of money is harder, literally, physically, and emotionally for kids. And moving when you're forced out is harder still.
So let's talk about being forced out and moving on to the second. And one of the things that I appreciated the most, you explain how these evictions not only affect the evicted, but community health outcomes. And I'd like to talk both about those levels. And I don't know if you want to say anything about eviction itself before we get into it, but those are kind of the two levels I wanted to explore.
Yeah, I mean, I guess just to give a little background on folks less familiar. I mean, I think people have a sense that housing has gotten more expensive, but really only in the last few years. So Matt Desmond is a sociologist. He's at Princeton now. Wrote this book called Evicted in I think came out 2016. Just talking about how many people experience eviction. And now they have a sort of nationwide system where they're going to court systems in every state and trying to buy proprietary data from these data brokers who track people's credit to try to get a handle on like how many people are getting evicted, who's getting evicted. And the estimates now are like, it's like 4 million people a year, every year. And if you think there's this paper about kids in big cities, basically, that even though it's, it's like 2% of the population or something gets, a little less maybe, gets evicted in a given year, if you're like a kid born into a big US city, about 1 in 7 of you are evicted by the time you reach adolescence. And if you're born into a family making 50% or less of the poverty line, it's like 1 in 4. and that process is also really deeply racialized, right? Because we live in a racist society. In our education system, in our neighborhood segregation, in our criminal legal system. And so, we're talking about among households where it's the like quote unquote household head is like a Black woman who is younger. It's like 1 in 8, 1 in 12. I can't remember who's a renter. Like every year is being evicted. And so it becomes like less of a thing that happens to people occasionally. It's like a life course event is what we call it. It's like a thing that shapes a whole community's life. And the question isn't really if, it's like often for some communities when. And so this is sort of motivated 2 levels of research as you mentioned, and then we can get into specific questions, but some of it is about what happens to evicted people. And then the other question is, well, evicted people are like part of our community, actually. And so what happens to those families ripples out. It can have implications for your neighbors, your family, your coworkers.
Yeah, and I was interested in how social networks and how family interconnections and what we kind of define as community, that health outcome is affected so profoundly by these evictions. And I'd love for you to begin by telling us what you mean by social community, and then how that kind of how the individual fits in within it. We'll get into that and the health.
Yeah. So it depends a little bit on like what kind of health outcome we're talking, but people who get evicted are community members. And so there's your sort of geographic community, people who you live near, who you develop relationships with, often have some sort of we call social support, right? Like sometimes it's money, sometimes it's watching your kids, sometimes it's helping you move something, sometimes it's information about jobs, right? And so there's and emotional support as well. So there's your geographic community, and then you have your sort of social network and your family network, who are like often financially intertwined with you, are socially intertwined with you. If something bad happens to you or vice versa, like they're coming to you or you're going to them. And then of course there's also like everyone we impact. So if you're talking about infectious disease, your community is also like who gets on your bus, who has to go to work sick because they don't have sick time and they can't afford not to. Who's your cashier, you know? So there's also more at like a city level, right? Like we think of just as little beings that are all disconnected, but when you start thinking about an infectious disease, like actually we're a network. We are a socially, spatially connected network. And I think people sometimes in a health context, especially, kind of forget that. You're like, well, I exercise. And you're like, you can exercise all you want. But if your neighbor doesn't have access to healthcare, like you actually may have a problem too.
And I noticed this paper deals a lot with COVID, and I think that really brought home a lot of the theoretical stuff.
Yeah.
But let's talk about some of the things that happen when someone's evicted.
Mm. Bless you.
Um, like allergies. With the more I'm thinking about the changing ecologies, as you called them,
Yeah, yeah, yeah.
and that. So if you talk about um, that aspect of how the eviction for the individual starts to impact the.
Everybody else, yeah. I mean, so you can imagine, I mean, a portion of people who get evicted, um, good on them, are able to like find another place to go, somehow come up with some money to put down a first month's rent and a security deposit, because by the way, you're not getting that security deposit back from the place who just evicted you. Um, and you weren't able to pay the rent in the first place. So somehow, sometimes people are able to find another place. A lot of times they aren't. A portion of those people become homeless, in the sense of having unsheltered homeless, so having to go rely on a shelter, having to live outside, having to live in an encampment for safety and community. And some people, what we call doubling up, which is this sort of euphemistic term of like you go live with your friends or your family. Um, and that can have a lot of implications for other people. So, especially in housing, if you're renting housing and you have additional people living with you who are not on a lease, especially in public housing, if you have additional people who are not on a lease, who may or may not have a criminal record, by the way, which means you can't live in public housing, um, people like put their own housing on the line often to take in family members and friends. But they also are living now in housing that has twice as many people often than it was intended to have. And so not only can that be financially stressful, there's a lot of interviews with families who take in folks or friends, and it's like, well, now we have twice as many people to feed. We're using twice as much water. There's sort of literal bills, but it also means you're just much more crowded. Like if one of you gets sick, how are you supposed to socially isolate in a house that, by the way, you maybe were already sharing rooms because it's hard to get a house where everyone has their own bedroom, and now there's like 4 extra people living there. And each of those people has a whole life. They go to school, they go to work, whatever. And so the chances one of you gets sick just amplify, it multiplies, right? Like the more people keeps doubling. Uh, And then, of course, there's just the psychological aspect of it. I mean, anyone who's visited their in-laws, like living in someone else's house, they have their own rules, they have their own time, they like parent their kids a certain way. It invites a lot of conflict, and some people are able to resolve that conflict and work through it. And other people, it's like very destructive to their relationships long term. And so if you think about the ways that having friends and family you're close with is important for your emotional well-being, but also your ability to weather financial shocks. It can sort of degrade that too.
And then if you add into what we had just been talking about with, loss of services and
Absolutely.
relying on those services for feeding your children, and you're taking in the non-evicted person is suddenly taking on a huge burden that comes in usually at a net negative, right? So your
Absolutely.
unevicted person is threatened health outcomes by the evicted person.
Yeah. And it's, I think we're a little wary in talking about this because I think the sort of implication is that like the evicted person is somehow like a health problem, you know? And I think the better framing is the eviction puts people in a position where it's harder to avoid health risks and it's harder for them to do what they want to do to protect their own health. It like takes people's options away for protecting and taking care of themselves and their kids and their families and their communities. And that's yeah, I think that's important.
Well, and I think it also speaks to what you mentioned before, which is the racial outcomes are disproportionately terrible for people of color and
Yeah.
minorities. And part of the reason is it's a stacking process, right? So, I mean, you get kicked out of your house for financial reasons. You've lost your you've lost your down payment. I mean, to get
Yeah.
in places sometimes deposit first and last month, you're talking thousands of dollars sometimes.
Yes.
And then there's the
I
credit.
mean,
Yeah,
yeah.
and it just stacks up. So it's not the,
Terrible. Yeah, and I mean the thing I think people who have money I think struggle with is like for the bottom 20% of Americans in terms of how much money they make, they're the average, like the median savings is $0. $0. And the median savings for the next 20%, like up to the fourth, is like a couple $100. I mean, there are many Americans, a huge plurality of Americans don't have $1,000 in their savings account, period. And so, having an apartment sounds like not a big problem for some people. It's like a huge barrier. Um, but I mean, I guess to get into health a little bit, it's not conjecture. So we look at, for example, during the pandemic, states who implemented eviction moratoria. So state policies that said, you know, no one has the money to pay the rent. We are just going to shut down the eviction process for a period of time. And hopefully, which ended up happening, getting some, emergency rental assistance from the federal government, keep people in their homes as part of the public health response. And we did a few studies looking at what happens when states lifted their eviction moratoria just through September 2020. So this is just from like March to September, 6 months basically. And you can see like the timing if you control for were other things shut down, were there school closures, were there business closures, how bad was COVID at that moment, and sort of statistically account for those things, lifting the eviction moratoria associated with many tens of thousands, hundreds of thousands of additional COVID cases, and nearly 10,000 deaths just in the first 6 months alone. And so we have these sort of policy experiments. We're like, well, what if we shut down the eviction process and then all of a sudden open it back up again? And we see that that's not, I mean, as people get sick, we call this an R in epidemiology, like the number of people they get sick on average. Like these things spread out. It's not just places that have mostly low-income renters. Like it's everyone who comes into contact with anybody else. So we see sort of on the very concrete infectious disease side that happening. But the other thing that I think is telling is sort of twofold. One is sort of how communities degrade when this happens. And the other one is sort of what happens to neighbors. And so on the community side, we talk about eyes on the street sometimes in urban planning, meaning like if you know your neighbor and you know that kid and you know their kid, it helps communities stay safe. It helps deter crime. It helps people be able to lean on each other when they need help. And so when people get evicted, like that community can degrade. Right? People don't know their neighbors anymore because their neighbors are 2 towns over and new people have moved in. This churn can sort of break the ties that hold communities together. And so we see as evictions go up, people's calls to 311 go down to try to fix community issues. Crime goes up, voting goes down, so that you're not as invested in your community, you're in a new address, people's ability to vote and motivation to vote declines. But the other super interesting thing from foreclosure research is these studies about what happens when your neighbor gets foreclosed on. And to you, that's kind of, I mean, it's like your health is not impacting them. So it's kind of this like weird random experiment where like when your neighbor suddenly gets kicked out of their house. And those foreclosure studies find like people gain weight, their blood pressure goes up. You can detect in people's bodies the stress and emotional burden that seeing people around you be disappeared basically by our housing system has. So it goes beyond just the, I mean, infectious disease is still literal, but it goes beyond that too.
Well, and I think that's an important point.
Sorry, I think I couldn't hear you on that last question because I think you're on me.
No, and it was great that you brought that up because
I think you still might be on mute now. Oh, there we go. Oh, I see.
Okay, so I think we're right a little behind here. There's a lag. I'd like you to talk a little bit more about that, how seeing your neighbors react, how seeing your neighbors get evicted or foreclosed on affects the person who is somewhat okay and stable, because I thought that was incredibly interesting.
Yeah, so there's a few different ways to think about this. On the foreclosure side, there's a very literal financial stake if you're also a homeowner. Right? If the house next to you is going under and is very evidently no longer being upkept, it has implications also for like your own home value. And so there's some thought that it causes financial stress that way. But I think that's also true of renters, right? If you are a renter in a neighborhood, often where many of the houses are owned by the same big landlords, especially if you're in an apartment building where you all have the same landlord and you're having trouble making rent, but you think, I have a good relationship with my landlord, I can make it through. If I'm a few days late, it'll be okay. And then your neighbor gets evicted. And you think, man, I'm screwed. If I fall behind, I'm going to be homeless. That the salience of eviction can really change when your neighbors get evicted or your neighbors get kicked out of their homes. That the sort of stress of living in our society trying to afford a place to live can mount. But in foreclosure, there's other wild health impacts too. In California, during the peak of the foreclosure crisis, One crazy thing that happened was that places that had more foreclosure um, also experienced, in some cases, outbreaks of West Nile virus because the pools that their neighbors used to have who got foreclosed on, those pools weren't being upkept anymore and became like a pond where mosquitoes spread and were able to spread infectious diseases, vector-borne infectious diseases to their neighbors. Um, so there's like a blight issue, there's like a financial stress issue, there's friendship bonds that get broken between neighbors. There are, wow, my neighbor is the person who used to watch my kids when I had to go to doctor's appointment. They are now gone. Oh, even for folks who don't have, if you have good relations with your neighbors, I think it's more hard hitting. But even if you don't have a good relationship with your neighbor, like their ability to stay housed actually has a lot of implications for how I feel about my housing and the kind of environmental conditions that my neighborhood um, is in that I experienced too.
And I think to wrap it up, what can be done about this? What from a health perspective, what is the best outcome and what can be fixed?
I get this question a lot, and sometimes I say, I'm a health researcher. I can't fix the whole housing system. But I mean, I think there's sort of short-term things and long-term things. The short-term things are if we know that evicted people are going to fall off the Medicaid rolls, are going to fall off SNAP, are going to fall off WIC, even though they're eligible, how do we make a social services system that says we're just going to make it less hard for people to stay on these rolls in general? How do we implement systems within doctors' offices that say, I'm going to screen my patients for their housing stability and then make sure that we have a system for reaching out to them to make sure they stay on their health insurance and are able to keep coming to our doctor's office so that we have some continuity of care. We make sure they have continuity of insurance, especially for federally funded clinics. Like that is a thing the public health infrastructure should be doing. In the long term, housing affordability is a real problem, and it's a problem both because our incomes are too low, and it's a problem because housing is too expensive. And so I think often people talk about a two-pronged policy solution. Some of it is we should be raising the minimum wage. We should be eliminating jobs where you are forced to work on tips alone. We should be ensuring people have access to economic opportunity. And then on the flip side, we just need to build more housing and build more public housing. There needs to be a much larger housing stock so that the landlords aren't able to price gouge as much, for lack of a better word. And also, if there are people who can't afford the rent because there just aren't good jobs for them because they're sick, we need to have a public housing system that's able to absorb them. And we really have not built any new public housing in like 25 years. So finding short-term medical solutions and long-term sort of income and housing solutions, I think, are core paths forward.